하나, 둘, 셋, 넷.
Left and right, left and right, left and right. 17. 하!
잊지 말아야 해 줄배선에 설 때 그는 부릅뜨고 고개를 들어.
This is an infographic about anemia. We have summarized it in one simple infographic. Move on to what is anemia. Anemia occurs when there is not enough red blood cells to carry oxygen to body's organ, and as a result, it's common to feel cold and symptoms of tiredness or weakness. There are many different types of anemia, but the most common type is iron deficiency anemia, and we can begin to ease symptoms of this type of anemia by adding iron to our diet. As we can see, there are three types of anemia. The first one is iron deficiency anemia, pernicious anemia, sickle cell anemia, megaloblastic anemia, anemia of chronic disease, hemolytic anemia, idiopathic aplastic anemia, and the last one is thalassemia. For someone who suffers from anemia, they will experience symptoms such as fast heartbeat, fatigue, distracted, weakness and dizziness, swollen hand, and pale or dry skin. Thus, there are few tests that can be done to diagnose whether if someone had anemia or not. The first test is physical exam. We can listen to heart for rapid or irregular heartbeat, listen to lungs for rapid or uneven breathing, feel abdomen to check the size of liver and spleen, pelvic or rectal exam to check for common sources of blood loss. Second, complete blood count test, which is CBC. A CBC is used to count the number of blood cells in sample of blood. For anemia, count of the red blood cells contained in the blood, which is hematocrit, and the hemoglobin in the blood. The last one is the test to determine the size and shape of the red blood cells. Some red blood cells may also be examined for their unusual size, shape, and color. This can help to detect whether someone had anemia or not. Move on to our problem statements. First one is what is the common factor of anemia? Second, people's awareness towards anemia. And how does anemia affect someone's lifestyle? Our objectives are to determine factors affecting the severity of anemia, to identify the common treatment and prevention to anemia disease, to recognize the most frequent symptoms and how it affects a certain lifestyle, and to identify which type of anemia is common in society and what is its cause.
Because of the COVID-19 crisis since 2019, for the methodology, we use an online platform which is Google Form to conduct this anemia survey among Malaysians. What a good things are, Google makes the Google Form integration interface almost intuitive and user-friendly to accessibility and receive responses. For our respondents in this survey are open to all ages among Malaysians because anyone can develop with anemia. Starting for the questionnaires, on this survey we ask is about personal information of our respondents like name, gender, and also their current age. And also follow with the personal questions about anemia. We used to ask our respondents which they have anemia or not to go through with the other following questions. To the respondents that doesn't have anemia, the following questions are: have you ever heard of anemia? And if yes, what type of anemia have you ever heard of? While for the respondents that have anemia, the following questions are: what type of anemia are you suffering of? What symptoms have you ever experienced? Did you get diagnosed from doctor? What tests do you go through to confirm you have anemia? What is the main factor that caused you to develop anemia? What are you doing to prevent your anemia from getting worse? And what treatment do you receive to cure your anemia disease? In the next sections, these are the following questions for all of our respondents. Does your family have a history of anemia? What are the following causes of chronic blood loss that cause anemia? In your opinion, What are the risk factors which make it easier for a person to develop anemia? Last but not least, I will show some of conversation with our respondents to ask more detailed manner about their knowledge and also their conditions of anemia.
From our survey that is obtained by the Google form, we can conclude that most of our respondents are female with a percentage of 85%, while for male is only 15%. Other than that, most of our respondents are in the range of age 18 to 25 years old with a percentage of 93%, followed by respondent from 26 years old and above with 4%, and the least age range is respondent under 18 years old with a percentage of 3%. From the data that are collected, we can see that most of our respondents did not have anemia. The pie chart shows that 85% of the respondents did not have anemia, while another 15% of the respondents suffer from anemia. All of the respondents that suffer from anemia are diagnosed directly from a doctor. It is also obtained that 53% have heard about anemia, while another 7% never heard of that disease. For respondents who suffer anemia, we can observe that the type of anemia that are most suffered by respondents is insufficient iron, result in fewer hemoglobin molecules in red blood cell, with a 90.9%, while red blood cell turn into sickle shape, extreme blood loss during injuries, bleeding ulcer or malaria, and deficiency of vitamin B12 absorbed by the digestive tract, have the same percentage of respondents, which is all three are 9.1%. And lastly, no respondent have suffered aplastic anemia. In addition, all of the respondents experience fatigue as their most symptom when suffering anemia, which is at 100%. Next, 63% of the respondents also agreed that they suffer weakness and dizziness, while 36.4% suffer pale as symptoms. It is followed by respondents experiencing symptoms that are irregular heartbeat and cool hand and feet, which is at 27.3%. The least symptoms that are experienced by respondents are chest pain and eating ice at 9.1%, while 9.1% more respondents do not suffer any symptom. When observing for the tests that responded with anemia go through to confirm they have anemia, 72.7% of respondents go through serum iron test, while 36.4% of respondents agreed with the folic acid test to confirm they have anemia. Other than that, some respondents take the vitamin B12 test at 18.2%, and the least test that are taken by the respondent is the ferritin test, which is at 9.1%, while 9.1% respondents share that they also take thalassemia test. From the survey, the main factor that caused the respondent to have anemia is having a diet lacking in iron and certain vitamins and minerals, which at 81.8%. Next, 36.4% of respondents suffer from anemia because of family history. The least factor that causes the respondent to have anemia is age, menstruation, and having intestinal disorder, which all three factors are at 9.1%. None of the respondents suffer anemia because of having chronic illness such as cancer and kidney failure. Next, for the way to prevent the anemia from getting worse, eating iron-rich food and drinking enough water to stay hydrated have an equal percentage that are chosen by respondents, which is at 81.8%. In addition, it was followed by eating food containing folate, which at 63.6%, eating food that are rich in vitamin B12 at 45.5%, and lastly, reducing the consumption of caffeinated products and tea at 18.2%. From the result and chart, 81.8% respondents agreed that they take folic acid supplement as their treatment to cure the anemia. Next, 27.3% of respondents take pain relief medication, 18.2% choose bone marrow transplant. None of the respondents do blood transfusion as treatment. For respondents who do not suffer from anemia, and we can observe that the type of anemia that are most recognized by respondents is red blood cell turned into sickle shape with a percentage of 68.4%, while followed by insufficient iron result in fewer hemoglobin molecules in red blood cell with a percentage of 59.6%. Extreme blood loss during injuries, bleeding ulcers, malaria are at 42.1%, and bone marrow cannot produce enough stem cells at 31.6%. And lastly, one respondent shared that they thought of low production of red blood cell when heard of anemia. We continue to the family history of suffering anemia. 94% of the respondents' family history did not suffer from anemia, while another 6% have a family history suffered from anemia. Next, from the survey, 56.3% of respondents agreed that childbirth play a big role as the causes of chronic blood loss that cause anemia. It was followed by surgery at 52.1%, stomach ulcer at 25.4%, and the rest at 1.4%. In the survey, we include the opinion question which asks what are the opinion of the respondent about the risk factor which make it easier for a person to develop anemia. Most of the respondents choose a family that has a history of inherited anemia at a percentage of 76.1%. Next, 67.6% of respondents think that the factor suffers from the blood disease and autoimmune disorder, followed by the use of drugs that can affect red blood cell production at 32.4%. 23.9% agreed that suffer from chronic illnesses as the factor. Last but not least, heavy alcohol consumption at percentage 9.9%.
Based on our survey, there are only 16% of our respondents who has anemia and 85% of our respondents that do not have anemia. As we all know, anemia is defined as a low number of red blood cells. In a routine blood test, anemia is reported as a low hemoglobin. Hemoglobin is the main protein in our red blood cells. If someone has anemia, the hemoglobin level will be low. If it is low enough, the tissues or organs may not get enough oxygen. There are many types of anemia and all have different causes and treatment. Some forms like the mild anemia that happens during pregnancy are major concern, but some types of anemia may reflect a serious underlying medical condition. From our survey, it shows that most of our respondents who has anemia are suffering the type of iron deficiency anemia or insufficient fewer hemoglobin molecules in red blood cells. Iron deficiency anemia occurs when our body doesn't have enough iron to produce hemoglobin. As we all know, hemoglobin is the part of red blood cell to carry oxygenated blood throughout the body. Now we know that iron deficiency anemia happens because they don't have enough of the mineral iron in their body. As most of our respondents are suffering from iron deficiency anemia, the symptoms that they have experienced are fatigue, weaknesses, and dizziness or lightheadedness. According to our respondents' answer, the main factor that causes them to develop anemia is a diet lacking in iron and certain vitamins and minerals. If we aren't consuming enough iron or if we are losing too much iron, our body cannot produce enough hemoglobin and iron deficiency anemia will eventually develop. One of the causes of iron deficiency anemia include a lack of iron in diet. We have to know that our body regularly gets iron from the foods that we eat. If we consume too little iron over time, our body can become iron deficient. In addition, for proper growth and development, infants and children also need iron from their diets too. Next, in our survey, we state the causes of chronic blood loss that cause anemia, whether stomach ulcers, surgery, or childbirth. And 40 from 71 respondents vote for childbirth. Women may bleed severely at childbirth, and many pregnant women already have anemia, which can worsen as a result of bleeding. Severe anemia can be linked to maternal of death. Iron deficiency anemia after childbirth is more likely to occur in low-income countries. We also asked our respondents' opinion about the factors that make it easier for someone to develop anemia, and we got about 76.1% of respondents' opinion is family has history of inherited anemia. According to Kristen Murray, MD, a hematologist with Scott and White Hospital in Round Rock, Texas, he said that many people think of anemia as something happens because of outside factors like poor diet, but in reality, several types of anemia are related to glitches in genes. Moreover, the type of treatment that they receive to cure their anemia disease is take folic acid supplement. Folate deficiency anemia is prevented and treated by eating a healthy diet. This includes foods rich in folic acid such as leafy green vegetables, nuts, enriched bread and cereals, and also fruits. The doctor will also likely prescribe the patient a daily folic acid supplement. If the folate levels return to normal, then patients may be able to stop taking it, but some people need a supplement for life. Last but not least, our respondents choose to eat iron-rich foods such as beef, beans, and iron-fortified cereals, and drink enough water to stay hydrated to prevent their anemia from getting worse.
Conclusion. Based on summary result, we had collected 71 responses by using Google Forms as our survey platform. We analyzed the data from the questionnaires on survey of anemia disease with all of these responses. The most common cause of anemia is low level of iron in the body. This called iron deficiency anemia with a lack of important vitamins and minerals in the diet. The major symptoms of anemia are fatigue, shortness of breath, and dizziness, also weakness. The action taken to prevent the anemia disease from getting worse are by eating iron-rich foods, as example, beef, beans, iron, and fortified cereals. Eat food that contain folate, which is dark green leafy vegetables, peanuts, and also citrus fruits. Eat foods that rich in vitamin B12, such as eggs, milk, and cheese. Drinking enough water to stay hydrated, and also reduce the consumption of caffeinated products and tea. The most effective treatment to cure the effects of anemia disease is transfusions of red blood cells, iron supplement taken by milk or folic acid supplement, and also bone marrow transplant. In this study, all of the objectives we had for conducting this survey were successfully achieved. That's all from us. Thank you.